So this past year has been a major change in leadership that occurred at PRIM&R. We began by celebrating our 40th year, and we welcomed our new executive director, Dr. Elisa Hurley, to PRIM&R. Elisa was not new to many of you because she was right with PRIM&R as the education director, and she's transitioned seamlessly into her new role. And as you can see, PRIM&R is continuing to flourish. I'm honored to call Dr. Hurley to the podium at her first AER meeting as executive director.
Thank you, Susan, for that warm welcome. I don't know why I okayed going after the song. So, hello, everyone. As Susan said, I'm Elisa Hurley, the Executive Director of PRIM&R. I'm so pleased to welcome you to Baltimore for our 2014 AER conference. I hope you're as excited about the next 3 days as I am. Before I talk to you a bit about the conference and about what PRIM&R has planned for the future, I want to add my thanks to David and Susan's and acknowledge some additional groups of people who have made this meeting possible. First, I want to thank Boston University and the AAMC for their ongoing support of this meeting. We're so grateful to each of them for their continuing partnership to make this conference possible year after year. I'd also like to thank our supporters and exhibitors, whom you can find right next door at their respective booths in the conference connection later today and throughout the rest of the conference. A complete list of supporters and exhibitors can be found beginning on page 86 of your conference guide. And I want to especially thank our Platinum supporters and invite you to consider attending one or more of the sessions in the Platinum supporter track this year. You can find more information about that track in the schedule section of your conference guide. I'd also like to acknowledge the PRIM&R Board of Directors, many of whom are sitting up front, who provide the organization with the thought, leadership, and wise guidance that we rely on to be successful, and our incredibly hardworking staff who execute the board's and my vision with such dedication, energy, and commitment. I can say it's really a privilege and pleasure to work with both of these groups. And they're listed by name in your conference guide on pages 94 and 95, respectively, and I know that they'd be delighted to meet any and all of you, so feel free to introduce yourself to anybody on those pages. And finally, I want to add my thanks to David and Susan's to our conference leadership, beginning with our fabulous conference co-chairs, David and Susan themselves. They were joined at the helm of our planning committees by Susie Hoffman and Elise Summers, co-chairs of our workshop and didactic planning subcommittee, and Sue Fish and Nancy Olson, co-chairs of our poster abstract subcommittee. You can find the full list of planning committee members on the inside front cover of your conference guide. And as you can see there, not only is this an incredibly accomplished group, they're also just a lot of fun to work with. And I can't overstate our gratitude to them for volunteering, as David said, close to a year of their time. It really is. And they do volunteer to craft the program that you're about to enjoy. 2014 marks the 40th anniversary of PRIM&R as an organization. That means that PRIM&R was founded the same year the National Research Act became law, 1974. As you know, that law created the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research, which would go on to write the Belmont Report, the document that articulates the basic research ethics principles that underlie the core U.S. regulations governing human subjects research. In other words, PRIM&R is basically the same age as what we might call the modern research ethics era. We literally grew up with the field. And we're lucky to count some of those who had a hand in crafting Belmont and shaping early discussions of research ethics in this country amongst PRIM&R's founders. We're proud of the role that we've played in the development of research ethics over the past 40 years and our association with its leading thinkers. Since its founding, PRIM&R has envisioned and promoted a world where research is designed and implemented to the highest possible ethical standards. Ethics, in its broadest sense, explores the fundamental question of how we should regard and interact with other living things with whom we share a world. To me, and full disclosure, I'm an ethicist by background, no question is more pressing, more important, or more central to what it is to be a human being. The need to thoughtfully address and appropriately answer this question presents real challenges in the context of conducting research with human beings, especially research involving populations who might be vulnerable in any way. After all, as we all know, it's the very nature of research to involve asking some individuals to bear risks and burdens for the possible benefit of others. Thus, PRIM&R believes that the pursuit of knowledge always shares the stage with the opportunity to protect, improve, and enrich lives. That human subjects are vital contributions to the research enterprise who must be protected and respected before, during, and after the research cycle. So as this conference's subtitle suggests, we're using this occasion, our 40th anniversary, to both reflect on our 4 decades of promoting ethically responsible research with human subjects and to look forward through the lens of that history to the challenges and opportunities that lie ahead. So I thought I'd share a few of the highlights around that theme from the next few days. Tomorrow, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases at the NIH, will speak to us about the evolving ethical challenges over 30 years of the HIV/AIDS pandemic. And his talk will be followed by a panel exploring larger lessons from HIV, including lessons for the current Ebola outbreak. On Sunday, Susan Lederer, the Robert Terrell Professor of the History of Medicine and Bioethics at the University of Wisconsin School of Medicine and Public Health, will refresh our collective memory about the bombshell that was Henry Beecher's call for reform in the 1960s for reform in clinical research ethics, and that in its continuing legacy for our field. Also on Sunday, we'll be joined by Ruth Faden, the Andrea C. Dracopoulos Director of the Berman Institute of Bioethics at Johns Hopkins University, Daniel Ford, the M. Levine Professor in the Welch Center for Prevention, Epidemiology, and Clinical Research at the Johns Hopkins School of Medicine, Kathy Hudson, Deputy Director of Science, Outreach, and Policy at the NIH, and David Lacks Jr., Veronica Spencer, and Jerry Lacks Y, grandchildren of Henrietta Lacks, for a conversation about the Henrietta Lacks case and its impact on our community. And between now and then, we'll be holding panels exploring how our conceptions of race and ethnicity in the context of research, of privacy and confidentiality, of norms for research across national borders, of the role of subjects and communities in research, and of the relationship between clinical care and research have evolved over the past 40 years, and where our thinking on each of those topics seems to be heading. Which means we're going to be exploring not just our collective past, but also our future, both the future that we can see coming and that which we're only really beginning to imagine. In addition to today's keynote address on informed consent in the mobile era by John Wilbanks, the Chief Commons Officer at Sage Bionetworks, we're also bringing you sessions exploring emerging topics such as patient-centered outcomes research, genomic data sharing, the Facebook emotional contagion study and its lessons for social media research more generally, the research use of mobile health technologies and electronic medical records, and a series of sessions on the scientific, regulatory, and ethical issues being raised by the Ebola outbreak that continues to unfold as we speak. When we stop to consider the distance that we've traveled as a field, from Henrietta Lacks's non-consent to the use of her tissue to proactively asking for consent to use tissue for research questions we've yet to think up, from thinking of ethical research across borders as a matter primarily of obtaining culturally sensitive and appropriate consent, to developing global research ethics frameworks that put considerations of justice, including local community participation in research design and access to research products at the forefront, it's clear we've come a really long way. But we also know that there remains a great distance yet to travel. It's an exciting but challenging time to be involved in the research enterprise, as everyone in this room knows. Regulatory change is in the air, budgets are tight, your professions are becoming ever more specialized, and research technologies and methodologies are evolving at an extraordinarily fast pace, and you're expected to keep up with it all. Well, that's where PRIM&R comes in. PRIM&R's purpose for the last 40 years has been twofold. First, we identify and convene a community, you, of individuals responsible for ensuring research protections or involved in the design and implementation of protocols. To support you, we offer a range of membership benefits that help you stay connected and informed, and we create and formalize professional standards and credentials documenting the specialized knowledge and skills necessary to appropriately do what you do every day. So if you're interested in learning more about the benefits of PRIM&R membership, I encourage you to visit the PRIM&R Pavilion right next door in the Conference Connection, or attend our Connect with PRIM&R session during the D-Series Sunday morning at 9:30 a.m. And if you want to learn more about how PRIM&R's certified IRB professional or CIP credential can help you in your professional growth, please stop by the CIP booth next door or attend the CIP breakfast 7 a.m. on Saturday morning. So second, we provide that community, again, you, with intellectually rigorous education, practical tools, and a dynamic international network to ensure that human subjects are respected and protected in the conduct of research. We do this through conferences like this one, intensive short courses like our pre-conference programs yesterday, which I hope many of you took advantage of, through online tools and online education and tools, webinars, and publications. This year, we've taken our short courses on the road to 12 different institutions through our At Your Doorstep program, and to the Midwest, West Coast, and Northeast through our regional meetings. We've offered 12 webinars on topics ranging from central IRBs to reviewing student research to fostering effective communication between IRBs and investigators. And we're constantly updating our content-rich online resource for members, our Knowledge Center, adding workplace tools, articles, and other materials almost daily. But you might ask, what about PRIM&R's future? What's next? As you may know, I became, and as Susan just mentioned, I became PRIM&R's second only executive director earlier this year. And one of the questions I've been asked a lot over my first 8 months is, what are my priorities for PRIM&R moving forward over the months and years to come? And it's a really good question. Well, my first priority is to ensure that PRIM&R keeps doing what we do best, which means remaining the professional and educational home and go-to source for all those in the research ethics and research oversight fields. But I know that in order to do that, we need to, as I like to say, mindfully innovate to keep up with the challenges that you all are facing. So one of the things I've been doing these first 8 months on the job is listening to what you, our members, our program attendees, and our partners are saying about what PRIM&R is doing well and what we can do better in the future to continue to serve and support you as you do the important work of advancing ethical research and as you grow within your own careers. So I've heard from you that PRIM&R's ethics education has a direct and immediate impact on your decision-making and your practices, that hearing from experts in the field and learning from one another, what you'll do almost nonstop for the next 3 days, helps you do your jobs better with more confidence and greater efficiency and to the benefit of your research programs and the human subjects who participate in them. But I also heard that you need more. So I'd like to share some of what we're working on now to continue to provide you with the support and rigorous education that you're used to receiving from PRIM&R. So I heard you say that you need more advanced programming, advanced level courses and program topics, so that you can keep up with the increasing complexity of your research oversight work, and so you can continue to grow and advance in your careers. So look for PRIM&R to roll out more advanced programming across our platforms, including a new short course coming within the first 6 months of next year, IRB Administrator 201, in the months to come. I've heard you say that you would benefit from novel learning modalities and methods, that it's not always feasible or desirable to travel to a face-to-face meeting or to squeeze a 90-minute webinar into your very busy days. So we're working on innovating around how and in what formats we offer our educational programming, on expanding our virtual and on-demand learning options, and on providing new resources that you can use to educate your own teams in small bites and on your own terms. I heard that you need PRIM&R to sift through the massive amounts of information available to provide you insights into what you need to know to actually do your jobs better. We've already started to develop new ways to help you digest, respond to, or apply to things like draft guidance and regulations, research ethics issues in the news, and empirical research on research ethics through our blog, Ampersand, and through our Knowledge Center. And we'll continue to expand our efforts and modalities for making PRIM&R your go-to source for the synthesis and analysis of complex research ethics issues. So I've heard you. It's clear the need for efficient, effective, high-quality education and professional development opportunities for you and your staff at all stages of your careers is higher than ever. I'm going to be leading our team in developing and implementing educational and professional development programming and resources that are responsive to this changing research and regulatory environment and to your evolving needs. So please stay tuned to see how we implement your ideas and other innovations in the months and years to come. And I really hope that people will also consider this an open invitation to reach out to us and to me personally to tell me where you think PRIM&R should focus its energies next. After all, we really are here to support you. So whether you introduce yourself to me here in Baltimore or send me an email after the conference, I look forward to hearing from you. So now, with 3 days of programming ahead of you, I urge you to take advantage of everything that's available to you here, from attending hands-on sessions on the topics of most concern to you, to networking with peers from across the country and around the globe, from getting your lingering questions answered by one of our federal partners, to browsing our gallery of 100 posters highlighting innovative research and practices around human subjects protections. Find the combination of activities that best addresses the challenges that you're facing. And if you have an idea for something that you'd like to see in a future PRIM&R conference, please let us know by filling out one of the evaluations that David mentioned. So let me close by thanking you all for joining us and for doing what you do every single day to advance the highest ethical standards in the conduct of research. We've been proud to support you and your colleagues for the past 40 years, and we're eager and ready to continue that support for decades to come. And I hope you all enjoy your meeting.